So, hello.
Hello.
My name's Margaret. What's yours?
Pleasure, Melody Cochran.
Okay, good. I'm going to do a blind physical exam on you. So, I'm just going to start with your back. And as I go around, I see that her AP transverse diameter is 1 to 2. There are no skeletal deformities that I can see, obviously. And I also have noticed that her IE ratio's 1 to 2. And these are things you get from inspection. So if you could put your knees to the wall, we're in good shape. Now you may want to come around here. Now, first of all, I'm going to do my inspection. I don't see any abnormal lesions. The spine is straight. There's no kyphosis or scoliosis. Now I'm going to actually palpate. Now when I palpate and when you do it, talk to me. Cervical, paraspinals, okay, thoracic, lumbar, sacral. Now there's no sacral edema. And there's no tenderness. Now, breathe in, breathe out. So chest excursion is symmetrical. Now say 99.
99, 99, 99, 99, 99, 99.
So from it just decreases in the periphery. Now percussion. So she's resonant. Now I find C7 vertebra prominence, and then I start to percuss. Now inhale and hold it. Exhale and hold it. Okay, good. Here's your diaphragmatic excursion, which is about 4.5 centimeters. Perfect. Now, other things on percussion. Costovertebral angle, no tenderness. Now, I get my ears, and taking a deep breath through your mouth. Now I hear vesicular sounds. They're 3 to 1, they're very soft. Now between the scapula, I hear bronchovesicular sounds 1 to 1. They're louder. Now, for consolidation, I'm going to do E to A, agophony. So could you say E, please?
E, 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 E.
So there's no E to A changes, there's no consolidation, or crackles, or wheezing. Okay, can you lie down here for me? Now I'm going to just move the head up to about 45 degrees. And make sure that you give the client some support for the legs. Now, if she didn't have a black turtleneck on, I would be double checking my JVD, because at 45 degrees, you want to have basically a JVD that's under 2 centimeters of height at the sternal angle. Now, at this point, I'm really going to concentrate more on the precordial. So, first of all, what I want to do is observe the chest. I'm not going to see much in the way of pulsations, so I'm going to actually try to locate them in this fashion. So I've got the apical pulse. And the PMI, point to maximal impulse, is 2 by 1. Tricuspid area is a pulsation. Pulmonic, yes, and the aortic. Now I know where to put my stethoscope now, so I'm going to start out with S1 is greater than S2 at the apex. At Erb's area, S1 is greater than S2. And at the pulmonic, I hear a physiologic split as she inhales. And then S2 is greater than S1 as it is in the aortic area. Now I go back with the bell, no S3 or S4. So for extra points, you can tell me about what causes an S3. So what causes an S3? Heart failure. And the louder the sound, the worse the patient. How about an S4? Low compliance due to coronary artery disease, hypertension, and myocardial infarction. Then I can play you a little bit of a rift. S3 or S4?
3. 4.
S3. Here's S1, S2. Now listen to S4, S1 and S2. The first two sounds are close together. That's the S4, S1, and then the S2 is separated. Okay, now that's it. We don't have to do any anterior pulmonary. Now in reality, of course you would, but for the practicum. Then we move on to the abdomen. Now the abdomen is rounded. It's symmetrical. The first thing I want to do is look for any pulsations, and we know that we're going to see an anterior pulsation left of midline, and that's going to be the aorta. Now just to go over the anatomy, remember above the umbilicus we have the splitting of the aorta, and that's one of the reasons that I want you to listen to bowel sounds in the right upper quad. And then I like people to listen to the renal arteries. So what I had taught you was use the belly button to draw one transverse line, and then right below your ribs, so halfway between the belly button and the bottom of the ribs, you've got the renal arteries. So going down the midclavicular line, I've listened to the bowel sounds, they're present. I'm going to listen to the renal arteries with the bell. I'm also going to listen to the aorta, the iliac arteries, and then superficial, I'm going to listen to the femoral arteries. So I've listened, and there are no bruits. Now I need to palpate. Now this is what I'm looking for. Bend the leg slightly. Thanks. Now I'm going to palpate gently with my hand, and there's no pain. And then I'm going to do deep palpation. Okay, inhale, exhale. Now I'm really looking for getting the directions here. Inhale and hold it. Now notice I didn't stick my fingers in during inspiration. Now on this side, inhale, exhale, inhale, now hold it. So there's no hepato or splenomegaly. Now I'm going to percuss. Okay, she's tympanic. But now I've got to get the liver border. Now I know that I want to start with what I know. Tympany. Now this is between the ribs. Oh, dull. Dull. Now, that's clothing, but it's different. Now, so her liver span's about 6 centimeters. Now, to confirm it, if you like, you can do the scratch test. So you can take your stethoscope and put the bottom part of the diaphragm here, and then when the scratching gets the loudest, that confirms your inferior border. Okay, now the deep palpation for rebound, you can do it. It's just that inhale, exhale. When she inhales and it comes up, that would cause rebound in the case of appendicitis. Now, let's go on down here to the exam, neuro. This really goes fast. Now, could you lift your leg up, please? Good. Now, put it down. Lift the leg out. Cross your other leg. Good. Now, we're going to get knee-hip flexion together, so lift your leg up to your chest. Now put your heel right here, and then just let the leg move out, and then across. So we've got hip rotation. Now, can you lift your leg up? Good. Now, push your leg down. So the quads and the hams are a plus 5 out of 5. Now, can you point your toe towards your nose? Towards me? Make a circle. Good. And the other way? Okay, now we're going to do strength. Now push, pull. Now we're going to check her for clonus. Thank you. That's not normal. She's putting on an act. That would have been like 3 beats of clonus. Good. Now this would be an ideal chance to do your Babinski. Now will you sit up for me? Now did you see how I integrated as I came down the leg? Now this is a good opportunity to do the calf tenderness, but we kind of already did that. But you could do it there. Now, can you lift your arms up and back? Okay, out. Here you go. Cross in front. Now scratch your neck. Scratch your back. That's shoulder rotation. Terrific. Now bend here. Extend. Wrists up. Wrists down. In and out. Fingers out. Fingers in. Flex. Extend. Ring. Perfect. Now we'll do strength. Right. Now lift your shoulders up and resist. Good. Now biceps, you're going to push up against my arms. Good. Now push down. Good. Now push against my hand. Pull against my hand. Now open your fingers out. Good. Now make a ring. Don't let me break it. Good. Now make a hand grasp. Good. Now I trust her, so I didn't do this, but if I didn't trust you, good. So actually she's +5 in all of her movements and the important muscle groups in the upper extremities. So that's